So there is some science of pain perception and psychological intervention for the chronic pain. So firstly we define what is the pain. Pain is an unpleasant sensory and emotional experience which is linked with actual or potential tissue damage. It is not only physical but also influenced by the psychological and social factors. For example, the two peoples with the same injury may feel pain differently due to the stress or mood. The pain perception. It is the process by which the body detects the harmful stimuli and the brain understand and experience it as a pain. It is not only a physical sensation but also an emotional and psychological experience. For example, if you touch a hot pain, the skin receptors detect the heat. The signals travel to the spinal cord. The brain receives the message and the brain perceives it as a pain and you pull your hands away. So there is some types of the pain. So pain is classified into different types and based on the duration, causes and sources. So understanding these types help the proper treatments. For example, the acute pain. Acute pain is the short-term pain that appears suddenly due to the injury, illness or surgery. It acts as a warning signal and usually disappears once healing occurs. For example, there is some characteristics like the sudden onset, the short duration which is seconds to the week, the related to tissue damage. For example, pain after a cut, burn, fracture or surgery is the example of the acute pain. There is some chronic pain. Chronic pain lasts for a long time, usually more than 3 to 6 months, and may continue even after the injury has healed. It often affects the daily functioning and mental health. For example, the characteristics include the long-lasting, may have no clear physical causes. It affects the mood and the quality of the life. For example, chronic back pain, arthritis, migraines, and fibromyalgia is the example of the chronic pain. There is some nociceptive pain. So this pain occurs due to the actual tissue damage and activation of the pain receptor which we call the nociceptors. It is the most common type of the pain. There is a subtype of this pain such as the somatic pain which may be the skin, muscles and the bone. The visceral pain which may be the internal organs. For example, pain from a wound, muscle strains, and the stomach ulcers. There is some neuropathic pain. Neuropathic pain results from the damage or dysfunctions of the nerve system, not from tissue injury. For example, burning, shooting, or electric shock like the pain, often having chronic activity. For example, diabetic neuropathy, psychatia, pain after the nerve injury. Now the other one is the neuropathic pain, such as we discussed previously. How we discussing the pain pathway will affect our body. Basically, it is the process through which pain signals travel from the injured part of the body to the brain. When the injury occurs, special pain receptors in the skin or the tissues detect the harmful stimulus and send the signals through sensory nerves to the spinal cord. From the spinal cord, these signals travel upward to the brain. So the brain then interprets the signals and recognizes them as a pain, deciding how strong the pain feel and how to respond. So this is why the pain is not only felt in the body but it's actually experienced in the brain. So there is some role of the brain in the pain. For example, the brain play a central role in pain because it is the place where the pain is finally understood and experienced. So when the pain signals reach the brain from the spinal cord, the brain interprets their intensity, location, and meaning. It also connects the pain with the emotion, thoughts, and past experiences. This is why emotions like the fear, stress, and anxiety can increase the pain. while relaxation and positive thinking can reduce it. The brain can even increase or decrease the pain signal, showing that pain is not only physical but also the psychological in nature. So there is some gate control theory of the pain. The gate control theory plane explains that the pain is not felt automatically. Instead, the brain can control and reduce the pain signals before they reach the full awareness. According to this theory, a gate in the spinal cord controls whether the pain signals are allowed to pass to the brain or are blocked. When the gate is open, pain is felt strongly. When the gate is closed, pain is reduced. So, the non painful sensation, such as the touch or pressure, can help to close the gate and reduce the pain. There is some psychological factors like the attention, emotions, and thoughts also influences the gates. For example, when you hit your elbow, rubbing the area reduces the pain because the touch sensation closes the gates and blocks some pain signals from reaching the brain. There is some psychological factors in pain. These psychological factors play an important role in how the pain is experienced and managed. Pain is not only a physical sensation, it is also influenced by thoughts, emotions, and the mental state. Feelings such as the stress, anxiety, fear, and depression can increase the intensity of pain by making the brain more sensitive to pain signals. Some negative thoughts like the hopelessness or excessive focus on pain can also worsen the experience. On the other hand, positive emotions, relaxation, distractions, and the strong coping skills can reduce the pain. For example, a person who is nauseous may feel a headache more intensity than someone who is calm. This shows that psychological factors can either increase or decrease the pain perception. Now, stress and chronic pain. Stress has a strong connection with the chronic pain. When a person is under stress, the body releases stress hormones and muscles become the tense. The tensions increase pain sensitivity and can make the existing pain last longer. Stress also affects the brain, making it focus more and pain and less able to control the pain signals. So over time, continuous stress can worsen the chronic pain conditions such as the back pain, migraines, and the neck pain. For example, a person with a chronic back pain may feel more intense pain during the stressful situation. This shows that reducing stress is an important part of managing the chronic pain. There is some psychological intervention. For example, some psychological interventions are treatments that focus on the mind, thoughts, and emotions to help manage the pain. They aim to reduce the impact of chronic pain on daily life by changing how a person thinks about, react to, and cope with the pain. These interventions do not remove the physical causes of the pain but help the brain and body handle it better. For example, a person with chronic pain learn relaxation techniques and the positive thinking to feel less pain and improve daily functioning. Therapies like the cognitive behavior therapy, which is the CBT, help to change the negative thoughts like I cannot cope into the I can manage the pain. So, what is the cognitive behavior therapy for the pain? So, the cognitive behavior therapy, which is the CBT, is a psychological treatments that help people to change the negative thoughts and the behavior related to the pain. Some chronic pain can make a person think I cannot do anything or this pain will never end, which increase suffering. The CBT teach them to replace the negative thoughts with the positive realistic ones and adopt coping strategies to manage the pain better. The techniques used in the CBT for pain include there is some relaxation exercise like the deep breathing, muscles relaxation, some activity pacing like gradual increase daily activities, some coping strategies like the distraction, positive self-talk. So there is some relaxation techniques. Relaxation techniques help to reduce the muscles tensions, stress and anxiety which often make pain worse. By calming the body and mind, these techniques lower the intensity of the pain and improve the coping. The common relaxation techniques such as the deep breathing, the progressive muscles relaxation, the guided imagery, visualization, or some meditations and mindfulness. So now, what is the mindfulness-based therapy, which is the MBT for the pain? The mindfulness-based therapy is a psychological approach that teaches people to focus on the present moment and accept the pain without judgments. Instead of fighting or fearing the pain, the patients learn to observe it calmly, which help to reduce the emotional stress and suffering associated with the chronic pain. For example, a person with chronic migraine sit quietly, focus on their breathing and noticing that headaches without the worry. This will run my day. Over time, the intensity of the pain feel more manageable and stress related to the pain will be the decrease. So there is some biofeedback for the brain. The biofeedback is the technique that will teach people to control badly body functions that are usually automatic, like the heart rate, muscle tensions, or the blood pressure. By using these special techniques, patients get real-time feedback about their body response and learn to relax or change them. This helps to reduce the pain, stress, and tension, especially in the chronic pain condition. So how the pain coping skill trains. For example, pain coping skills training the techniques people practical way to manage the chronic pain in their daily life. It focuses on changing the behavior and thoughts that make pain worse and developing strategies to stay active, reduce the stress and improve the quality of the life. For example, activity management and pacing, like break tasks into the small steps to avoid the overexertions. For example, walking 5 minutes at a time instead of 30 minutes at once. Second one is the distraction techniques. Shift attention away from pain to reduce its intensity. For example, listening to music, reading, or some hobbies. There is some benefits of psychological intervention for the pain. For example, psychological interventions help people to manage chronic pain by addressing both the mind and the body. They do not eliminate the physical cause of the pain but reduce suffering, improving the coping, and enhance the quality of life. For example, a patient with chronic back pain practices the CBT, relaxation and activity basic. So over time they feel less pain, are more active, sleep better and participate in social and work activities. So there is some current research and advances in psychological pain management. Recent research in the pain science showed that the combining the psychological approach with medical treatments lead to much better results for people with chronic pain. Researchers are exploring how the brain processes the pain, how emotions and stress influence the pain intensity, and how the new therapeutic techniques can improve the outcomes. So there is some growing evidence that interventions like the cognitive behavior therapy, which is the CBT, some mindfulness, virtual reality therapy, and digital health apps can significantly reduces the pain and improve the daily functioning activity. So advance in the neuroscience also revealed how the brain pain network can be retrained through the therapy, helping the patient reduce the pain sensitivity and improve the coping. So, as a concluding marks, pain is a complex experience that involves both the body and the brain. Chronic pain is influenced not only by physical injury but also by psychological and social factors such as the stress, emotions, and support from others. Some psychological interventions, including the CBT, relaxation, mindfulness, biofeedback, and coping skill training, play a key role in helping people managing the pain, reducing the suffering, and improve the quality of the life. So current research showed that combating these interventions with medical treatment is most effective, and advances in the neuroscience and technologies are making pain management more accessible and personalized. So understanding the science of the pain and applying the psychological strategies empower patients to take control of their pain and live more fulfilling lives. Thank you so much.